Good morning, good afternoon, good evening, colleagues. We're at the hour, so I think we can go ahead and make a start. I'm sure most people will join us as we progress. Welcome to our monthly HDC webinar. I have to say I'm particularly excited about this month's webinar, which will be discussing how to measure alignment, methods and findings from the SDG3 GAP heat map. This webinar is being recorded, so in case people aren't able to join us live, it will be made available to everybody through the HDC YouTube channel right afterwards. Please do feel free to ask questions. You can use the Q&A function in the Zoom. We've been doing this for over 2 years now. We all know how it works. And also feel free to use the chat if you would like to. Again, this is particularly exciting for us because it really speaks to one of the core objectives of the Health Data Collaborative, which is improving alignment. So today we'll be hearing from Isadora Quick and Roger Drew, who will tell us about the SDG3 GAP heat map, a tool for measuring alignment across the SDG3 GAP agencies. And for those of you who don't know, the SDG3 GAP is an initiative which was established back in 2019. It's a set of commitments by 13 multilateral agencies to strengthen their collaboration. The SDG3 GAP, or GAP as we call it for short, offers a platform for collaboration available to all countries to support an equitable and resilient recovery towards the health-related SDGs. This is, of course, particularly important in the context of COVID-19. And it hopes to do this by deepening and scaling new ways of collaborating. Hopefully, with this, GAP agencies can achieve greater impact and improve efficiencies in aligning their assistance with country-led strategies. In line with their commitment to account for progress made, SDG3 GAP signatory agencies approved a monitoring framework recently, which is expected to allow them to review progress, learn together, and to enhance shared accountability. As part of this framework, signatory agencies have developed a short annual questionnaire for national governments, which aims at eliciting country perspectives on two main issues. The first being how well aligned development partners' support is to national priorities and plans. And secondly, how well do development partners collaborate with each other? A question which I think we're all struggling to answer, even as we speak within the Health Data Collaborative. So again, particularly excited about this webinar today. You're all most welcome. And without further ado, I'm going to go ahead and hand over to Isadora Quick to take us through the presentation. Isadora, over to you.
Thank you very much, Mwenya. So my name is Isadora Quick, and I work in the Secretariat of the SDG3 Global Action Plan, which is hosted in WHO. And today I'm joined by Roger Drew, who has supported the Secretariat in developing the monitoring framework and analyzing the results of the responses we've received this year. I'm going to start the presentation by giving you a little bit of background information on the SDG3 Global Action Plan and how the monitoring framework was developed. And then I'll hand over to Roger, who will talk you through the methodology and the analysis of the results. Okay, So this first slide is really a summary slide on what the Global Action Plan, the SDG3 Global Action Plan really is. As Mwenya said, it was launched in 2019, and the goal was to accelerate progress towards the health-related SDGs by improving focused collaboration and joint action among 13 multilateral agencies in support of country plans and national priorities. So you can see the 13 multilateral agencies, the logos are on the slide. And the Global Action Plan is coordinated and led by WHO. And the reason why it was felt in 2019 that it was important to establish the SDG3 GAP was that global health architecture is complex, sometimes leads to duplication and efficiencies, and increases the burden on countries. Many countries are off track to reach the health-related SDGs, even more so now after COVID-19 and the economic, social, and health impacts it has. And stronger collaboration among the multilaterals and in general among development partners is really one of the ways in which we as the international system can help countries accelerate progress towards the health-related SDGs. In its essence, the Global Action Plan is really a self-commitment of 13 agencies to work better together and to support countries better. It is made of 4 key commitments, which you can see here on this slide, which are to engage with countries better to identify priorities and plans, accelerate progress in countries through joint action, align the support that countries receive by harmonizing operational and financial strategies, policies, and approaches. And finally, the commitment to account by reviewing progress and learning together to enhance shared accountability. And today's presentation is really very much focused on this last key commitment to account and review progress made. Very quickly, I just wanted to include this this slide, which shows the theory of change. I will not go through it in details, but really I just wanted to mention that the main the key message, I would say, of this theory of change is that the both the more administrative and process-based actions of the agencies, as well as the actual outcomes and impacts, are strengthened by changing the ways these 13 multilaterals work together, by trying to aligning better the programs and the plans. Yeah, and I won't go in more details because I think it's out of the scope of today's webinar. But this is all available online if you want to have more information on this. So now on the monitoring framework, as I mentioned, there is a commitment to account for progress made, and therefore a monitoring framework was developed. But the actual commitment to account also includes the commitment to publish annual progress reports. And we have now published 3 progress reports, 2020, 2021, and 2022. These progress reports include also country case studies, which really try to go in depth and showcase how closer collaboration has led to increased impact at country level. And then finally, we also, and this is really the topic of today's webinar, but we also developed a questionnaire for national governments, where national governments were able to basically assess how well the collaboration is among development partners is happening in their countries, and how well development partners align to their national priorities and plans. So how did it all happen? Well, the monitoring framework of the Global Action Plan was developed in early 2021. We had consultations, member states consultations, civil society consultations also, and it was finally approved by the principals of the 13 multilateral agencies in May 2021. And the document is accessible on our website. So the document has mentions 3 main sources of data. One are the country experiences through country case studies. Second are country perceptions, which are assessed through different questionnaires. And we today are going to talk about the country level questionnaire for national government. And then third, the agency perceptions. So there's also the perception that the agencies have of themselves and the collaborative work that they have undertaken. So what is the status? This questionnaire for national governments was first piloted in 8 case study countries. It was then rolled out to all low and lower middle income countries during 2022. And a WHO sent a letter to all its member states informing them of this questionnaire, and specifically targeted low and lower middle income countries, as these are the countries where most of the development partners are active and where collaboration makes most sense and would have the biggest impact. We asked member states to identify a national focal point who would be responsible to respond to the questionnaire, and we suggested that this person be the highest ranking civil servant in the Ministry of Health, as we thought this person should have an overview of the work of all of the different agencies, development partners active in health. And we shared an online questionnaire between January and June 2022, and we received 52 responses from countries. And now I will hand over to Roger, who will walk you through the methodology and the analysis of the results. Roger, over to you.
Thank you, Isadora. So as Isadora mentioned, countries were invited to nominate focal points, and there were 75 focal points nominated, and 14 of them were in upper middle income or high income countries. So from among 55 lower middle income countries, 39 nominated a focal point. So that's just under 3/4, 71%. And among 27 low income countries, 22 nominated focal points. So it was higher in the low income countries. As Isadora mentioned, 52 questionnaires were returned, which is 69% of the focal points. And this was higher in the low income and low middle income countries, where it was 3/4, 46 out of 61. The highest rates of return were in Africa and Eastern Mediterranean region and in low income countries. Next slide. So this slide just shows that those percentages. So on the left, you've got the six WHO regions showing a high response rate in Africa and in the Eastern Mediterranean, lower response rate in the region of the Americas and the European region. And then in slightly over to the right, you've got it shows that the response rate was highest in low-income countries, then the lower middle-income countries, and then in other. And the overall rate I mentioned was nearly 70%. Next, please. These were the quantitative questions that people were asked to answer. So it was a very simple questionnaire. They were only asked to answer 6 quantitative questions, and they had 5 options. So strongly agree, agree, neither agree or disagree, disagree, and strongly disagree. And there were 2 general questions, one about the align, as Isadora said, that the issue is about alignment and coordination. So one was about how well aligned are the development partners, and the second was about coordination. One of the things you'll notice is there's no actual mention of GAP here. And this was deliberate based on the piloting, where from the point of view of countries, they didn't distinguish between those multilateral development partners who were part of GAP and those other partners. So the idea of the Global Action Plan is that by better coordination between multilateral partners, it will lead to overall better coordination with development partners. And also that many of these countries may not be high recognition of the name GAP, and that's not the intention, that it should be promoted as a brand. So that was why it was specifically asked about development partners. And then we identified 4, if you like, tension points where people had said there were often problems with coordination. So that's the provision of financial support in line with national budget priorities, the use of national monitoring systems and reports, coordinating activities, including having a joint technical assistance plan, and the use of national coordination mechanisms and not setting up their own parallel mechanisms. And the intention is that these questions could be adjusted in future iterations. Clearly, the more we ask the same questions and the better trend analysis we'll have. But if particular issues or tensions are noted, then we could add a question in future rounds. Next, please. So just to say a bit about the limitations, because I think there was an interest in the methodology. So I'll say a little bit about those. First of all, clearly the response rate was less than 100%. But having said that, you know, for a questionnaire of this nature, the response rate was good. A bigger limitation, perhaps, is this is by a single respondent in a single ministry. So it may not reflect all views in the Ministry of Health, and it may not reflect views in other ministries. But as Isadora said, we specifically targeted, the permanent secretary or equivalent in the Ministry of Health with the intention of trying to get a high level assessment. This is self-reported, and it's not verified or validated, which means that comparisons between countries is fraught with issues, because just because one person ranked something in the same way doesn't mean somebody else would. So that leads to this inter-observer variation. So we have to be cautious about making comparisons between countries. And there's also this concern about desirability bias, that respondents may give the answers they feel the WHO wants. The other issue that has come up following this is there's little issue-specific data, say about immunization or about One Health, but that was never the intention of those questions, although this instrument could be adapted in future iterations to ask such questions if there was interest in doing that. Next, please. So in one country, in Malawi, there were also questionnaires as part of a piloting answered by the agencies and by one civil society organization. As Isadora mentioned, the intention is to have questionnaires which are answered by government, by the agencies, and by civil society to give some triangulation and validation. The idea was that the agencies would submit one response through the UN country team. This proved tricky and didn't happen in the case of Malawi. And we have found quite a lot of difficulty in trying to find a way of getting a consolidated response from civil society. Having said that, I think the analysis is possible even if you get multiple responses. So what this slide basically shows two different ways of counting, which I'm going to explain in a bit more detail. But the first is just the number of responses where somebody agrees or strongly agrees. So the possible highest number is 6. You'll see that the government in Malawi had no responses where it agreed or strongly agreed. And in among the agencies, it ranged from 1 for the Foreign and Commonwealth Development Office and 5 for UNFPA. And the civil society organization had the highest score of 6. All its responses were either agree or strongly agree. And you got similar results with the numerical system, except in this case, UNICEF's score was slightly lower than government. But I think what this shows in this case in Malawi is that if there is desirability bias, it's probably more with the agencies and this particular NGO. And with the NGO, it could be related to funding. With the agencies, it's actually rating their performance in terms of coordination and alignment. So it may be that government is actually in this situation a more critical partner, but we don't know if these findings would be replicated in other countries. Next, please. This slide simply shows how many questions each agency answered the same way as government. So how many of the agency scores matched government scores. So you'll see that FCDO and WHO, 4 out of 6 questions they answered in the same way as government. So they had a similar kind of outlook to government. Whereas in the case of UNFPA and the civil society organization, none of the responses matched government. Next slide, please. So in terms of the heat map that Isadora quickly showed you, the color coding is, I think, fairly intuitive, but it's listed here. So the bright green is strongly agree, the light green is agree, yellow is neither agree nor disagree, amber is disagree, and red is strongly disagree. So if you like a modified traffic light system. Next, please. And this just shows the heat map. That if for those eagle-eyed among you, this only has 51. Tanzania response came in fairly recently, so we haven't added that it's included in the numerical analysis, but not here. It's interesting that when agencies see this, they comment on the lot of green, whereas when I look at it, there's a lot of yellow and amber. But I guess if you, it's different how you look at it. But I think I think that's why a lot of focus came on desirability bias. Was it giving a biased, a more positive picture than the reality? Next slide, please. So in terms of the two methods, I was asked to say a little bit in detail about the methods because of interest. So the two methods, the first one is very simple. So it's simply the number of responses agree or strongly agree. So the problem with that method is it basically doesn't distinguish between agree and strongly agree, and it doesn't distinguish between neither disagree or strongly disagree. So it's basically just using a binary system of agree and strongly agree or another response. The second response was to convert the responses to a numerical value where 0 is given for strongly disagree and then up to 4 for strongly agree. Next slide, please. If you look at the number of responses that were agree or strongly agree, the possible range, as I mentioned, is from 0 to 6, and around a quarter, the dark blue in the left upper quadrant, around a quarter agreed or strongly agreed with all statements. So this is around a quarter of focal points responding. If you go to the upper right quadrant, you'll see that around a quarter agreed or strongly agreed with 2 or fewer statements. And if you look on the left-hand side, more than half agreed or strongly agreed with 4 or more statements. Next, please. If you look at the numerical system, the possible range is from 0 to 24 because you can score up to 4 on 6 questions. And then this is converted to a percentage. And the range of scores was between 17 and 92%. And the graph on the right is basically comparing the two methods. So on the y-axis, you've got the percentage score, the second method, and on the x-axis, you've got the first method. So you can see there's a very strong correlation, but there is variation. And the table at the bottom, which I can't actually see the bottom of, but it's basically showing how the percentage scores, the numerical system, the range that you can get in each of the scores from the first system. So 0 is from something like 17 to 46%. But so there is quite a wide range within that numerical score, and this is because the second method distinguishes, it's a more graduated method and it's not so binary. Next, please. If you look at it as to the score by region or by country income level, the two methods give very similar patterns. So higher scores in Europe and Western Pacific and lower scores in Eastern Mediterranean. Similarly, the lowest score in low-income countries, and it shows more clearly a graduation in the numerical system. A couple of notes of caution. One is that the numbers of countries outside the African region and Eastern Mediterranean region were low. And in some regions, particularly in Eastern Mediterranean, there was a lot of engagement from the WHO country office explaining to countries that we wanted really honest assessments. So this could be a reason why the scores were lower in that region. Next, please. This is just looking at the two methods. So the blue bar is the first method, the orange bar is the second method, and this is looking across the 6 questions. And what you can see is that in general, there were generally higher scores for the more general questions and lower scores for the more specific questions, with the possible exception of the use of a national monitoring and evaluation system. But the lowest scores were for the joint TA plan and the use of national coordination mechanisms. Next, please. There was also a lot of qualitative, well, not a lot of qualitative questions, there were a lot of qualitative responses. So basically, there were, I think, 4 qualitative questions. So there was what is going well or less, good practice. Second, challenges. Third, what could be the corrective measures? And then there was anything you wanted to say to the agencies that you didn't want made public. And so these are some of the things which came up. So the need for clear principles on which alignment and cooperation can be based, a formal agreement between government and development partners, an operating framework, a clear document such as a health sector strategic plan, the use of essential health packages as part of a national health plan, a national coordination mechanism. And then there were a number of matters relating to planning, funding, monitoring, joint programming and reporting. Next, please. Also relation to relationships, and there were quite a lot of comments about how well coordinated COVID responses had been in some settings. There was also some measure, there's always a question of, well, okay, you've got better coordination, better alignment, but so what difference does it make? And we did not specifically ask that, but some people mentioned it anyway. And also one country commented specifically on the contribution of SDG3 GAP. Next, please. When we were looking at the challenges, we distinguished 2 main types. So there were challenges related to the local environment, like political context, lack of capacity, government bureaucracy, lack of the key elements needed for effective coordination and failures of coordination. And then perhaps unsurprisingly more on the agency factors. So the fact that agencies often had what were considered inflexible principles, agendas and mandates, that there was often competition between agencies. The geographical distribution of agencies often was not very equitable. Sometimes agencies worked with third parties and not government. There were parallel coordination mechanisms and what I somewhat politely put, diverse, difficult and bureaucratic administrative procedures. There were some forms of technical assistance that might be inappropriate. And then some of the things which had positives also had negatives relating to planning, for example. Next, please. I think this is back to Isadora. Thank you.
Thank you very much, Roger. Yes, and this is just the final comments around how we could use the responses we received. As we mentioned, this is supposed to be an annual questionnaire sent to member states. We are hoping, of course, to increase the number of responses we receive. This year we got 52. We're hoping to increase them next year. And in a way, we are now thinking about how best we could use this data to improve the quality of our collaboration at country level. And these are questions that we also would like to ask you. How can this feedback mechanism be useful to countries? And also, how can it be useful to HDC members? You know, SDG3 GAP and HDC are very much aligned in their aims and their goals to better align the multilateral support to countries. So really, this is open questions to you, and we look forward to your comments and to your questions if you have any. And I'm not sure, Mwenya, whether you'll share the slides, but I've just included links here that might be of interest to all. So thank you very much. Mwenya, over to you.
Thank you so much to both Isadora and Roger. And I certainly will share the slides. They'll be made available through the HDC website alongside the recording after this. So once again, thank you for a very interesting presentation, the topic which is, of course, very dear to our heart, all of us here as the Health Data Collaborative. We've certainly tried to define alignment. We've tried to measure alignment. you seem to have found a potential solution to this everlasting question of what is alignment and how do you measure it, how do you improve it, and certainly grateful for your work and for your findings. We have a couple of questions in the Q&A, and I encourage attendees to go ahead and add questions or even jump in if you want to. We have a good few minutes left, and I noticed that we have some people here on the line who are particularly vested in this. Some of our consultants from the previous work that was done within the HDC on measuring alignment may have plenty to say about this, so definitely look forward to hearing your views and to exchanging views on the topic. The first question comes from Vikas. Vikas is one of the co-chairs of the Data and Digital Governance Working Group of the HDC, and he wears several hats amongst those. And Vikas wants to know if the questions were validated or if the responses were checked in any way, and also were the responses provided by 1, 2 people or group was set up with partners to respond. Over to you.
Thank you, Vikas. I can take these. So no, the questions were not validated or checked in any way. We sent out the questionnaires to the focal points who was nominated by the respective government, and we used the feedback provided as such. And regarding who in the Ministry of Health or in the government responded to the questionnaire, so the letter which was shared with all member states suggested that the focal points nominated should be the highest ranking civil servant in the Ministry of Health. This, of course, was not always the case, but countries were, had the liberty to nominate whoever they thought best. And so the person who actually responded to the questionnaire in each country is sometimes has a different role in the Ministry of Health or Ministry of Planning. It was, however, one person who had the responsibility, in a sense, who was named as the focal point. We know from our piloting exercise, so the piloting exercise we undertook in 8 countries, we know from that exercise that in many cases, several people in the ministry were involved with answering the questions, but of course, only one person is nominated as a focal point, and we do not have the information on who were the other people involved in responding.
Thank you so much, Isadora. I have a couple of questions of my own. I noticed that you had mentioned civil society, and again, a big congratulations. This is one of the things that everybody struggles with, not just within the Health Data Collaborative. When we did our own sort of measurement or assessment of alignment within a number of different HDC impact countries, 2 groups we struggled specifically with, not necessarily targeting, but more specifically, we struggled with knowing if the questions should be the same or if the assessment should be the same. And those 2 groups are, of course, civil society and the private sector as well. So I wanted to hear a bit more from both of you on your experiences when it came to getting responses from civil society and perhaps from the private sector. Maybe I could even extend that to include research and academia. I think within the global health community, with the multilaterals and the global health initiatives, this exercise is relatively easy to do. I mean, it's more or less much more standard and much more formatted. But certain, stakeholders are a little bit more complex, although just as important. So perhaps I could hear a little bit from you on your experiences with interacting with civil society, with the private sector, and perhaps I'll include research and academia into that exercise. Thanks.
Thank you, Monia. Perhaps I can start and then Roger, you can complement. So don't congratulate us too quickly because what we did this year was really, we rolled out the questionnaire for national governments. In the monitoring framework, we have questionnaires also for civil society, and we have a questionnaire which is addressed at the, let's say, we call it UN country team, but actually it's addressed to the agencies and the development partners who are part of the coordination mechanism at country level, to basically do a self-assessment of how well they collaborate. In our thinking, both the civil society questionnaire and the questionnaire for the development partners at country level the idea was that we would receive one questionnaire, one feedback from each country, which would entail that at country level, there would be an exercise where, for example, agencies, development partners would sit together, and together they would respond to this questionnaire. And the same would happen with civil society. Of course, we knew already that it would not be easy, and we have this year tried to pilot these other two questionnaires, so the civil society and the development partners country teams, in a number of countries. We were not very successful in terms of response rates in the piloting exercise. So our thinking is to do it again next year, try to pilot it again to really understand. However, I think it is interesting that, for example, the Malawi example, which Roger mentioned during his presentation, it is interesting to see that in Malawi, we got feedback from one civil society organization, which of course does not represent a view from Malawi civil society. And then it's also interesting to see that the feedback we received from the agencies in Malawi was separate feedback. So UNICEF sent their feedback, GIZ sent their feedback, etc. We did not receive one feedback as we had imagined it ourselves, one collated feedback from the agency. And this is telling, I think, already, and shows that our ideas were maybe not realistic, or also that we have not, in a way, explained our thinking behind it enough with the country teams, so that they could really implement it as we had thought. But I'll hand the floor to Roger, who maybe has things to add. Thank you.
Yeah, if I may start with, I think with the first question, as Isadora mentioned about that the questions were tested in the pilot countries, but not validated as such. I think the thing to stress as well was this was quite revolutionary in many ways, because we're used to the agencies sort of commenting on countries, but to get the governments to comment on the agencies was quite revolutionary and also uncomfortable, I think, probably for some agencies. And there was a degree of validation in Malawi, and I think this is a way forward to get views from civil society and the agencies as well, as a form of triangulation. And as Isadora mentioned, the government was the least positive in Malawi, but as I mentioned in the presentation, this may not be the case in other countries. In terms of the multilaterals and civil society, I think we were perhaps a little too fixed on trying to get one consolidated response. I think it is quite telling when if agencies were able to give a consolidated response, that would be good. But in terms of analysis, it can be handled even if we don't get that. The other challenge with the multilaterals was not all the UN agencies and not all having country presence. So this is an issue. So you'll see that actually in the responses in Malawi, some were not GAP agencies and not all GAP agencies responded. With civil society, we had a really good meeting with international civil society. And I think if we wanted to consult international civil society, it would have been fairly easy, but we didn't want to do that. We wanted to consult national civil society. And I think because we were focused on getting a single response, that proved quite difficult. I think probably going forward, we probably just need to accept that civil society organizations will probably want to submit their own response, except in countries where there is, say, an NGO coordination mechanism that might be able to submit a consolidated response. And just to say, on private sector and academic, that hasn't really been discussed. It's not to say that it's not important. Those sectors are not important, but I think, as Isadora said, we shouldn't be overclaim for what has been achieved. We did not have not as yet considered those sectors, although I mean, one thing to say is when WHO talks about civil society, it tends to talk about non-state actors, and so non-state actors would include those groups. So it might be possible to have a single questionnaire to which all non-state actors could respond, because I mean, the other thing I would say is that WHO is very good at engaging with ministries of health, and engaging with civil society and non-state is an area of growth and development. I would say traditionally WHO has been better at engaging with ministries of health, which I think is, sorry, one final comment, which I think is reflected in the high response rate. You know, that these established relationships, particularly between WHO country officers and the countries, and so I mean a response rate from Ministry of Health of, you know, nearly over 2/3 is very high in my experience.
Thank you so much to the both of you. And I just recognize that we're speaking about Malawi quite a bit, and we do have the government of Malawi here as part of our attendees, or at least a representative from the Ministry of Health of Malawi. So you're very much welcome, and please do join the conversation if you have anything to add. A few more questions in the chat. I might call upon a colleague, Tashi, who was for a long time on the other side of the exercise. Tashi is with us at the WHO, and she previously held a senior position in the planning division of the Ministry of Health of Bhutan. And so I'd be quite interested to hear from you, Tashi, on your experiences, and perhaps if you have any reflections on the discussion at hand. Tashi.
Thank you, Wenya. Thank you, Wenya. Thank you, Isadora and Roger, for the presentation. It's not a question, it was just my opinion working in the Ministry of Health in the planning division, because towards the beginning, Isadora was saying that you were targeting responses from high-level officials in the Ministry of Health. So, so my opinion, so I would just like to say that high-level officials like the secretary, they do not oversee the planning and budgeting exercises. They only oversee it at a very macro level, and they do not understand how things really work. So it may be worth getting responses from other officials, even if they're not even if they're not high level, someone in the planning department or division. But later you clarified that most ministries of health designated officials who they thought could better respond to these questions. So I'm happy to hear that. And I, from Bhutan's, just to share my experience, coordination and alignment of partners, it's very difficult, even for a small country like Bhutan, with the with the population of just above 600,000 people. And we carry out roundtable meetings, and for instance, I would be the focal for WHO, my other colleague for UNICEF, another one for UNFP. Even coordinating between ourselves in a small office is challenging. I can only imagine how difficult it is at the global level, but happy to see many initiatives. The SDG3 GAP Secretariat doing a lot of good work, and even in the health data collaborative, in which I'm part of the secretariat. So happy with these initiatives, many initiatives that's going on. And I would like to end with a question. So I understand that this questionnaire, this exercise would be carried out on an annual basis. So if somebody, for instance, I respond this year, and next year another colleague responds, I don't know if there will be consistency, or how do have you thought about ensuring consistency or something like that, yeah, around that? Thanks.
Thanks, Tashi. Very good points and good question. Isadora, over to you.
Thank you very much, Tashi. And yes, indeed, I think we're very much open to feedback also, and that is why we try to pilot this questionnaire to really understand who would be best placed in the different ministries to respond to the questionnaire. For us, it was mostly important that it was that the person responding was not only responsible for a specific disease-specific sector, and because we know that that's happened in the past, and because our questions are very broad on health coordination and not on HIV coordination, for example, we thought that that was most important. And so we asked for someone who had an overview of programs. But I mean, your comments are very valid. And indeed, I mean, member states were then able to choose whomever they thought would be the best person who has this information. I do think that it would be best to probably have a group of people in the ministry who give their opinions on the same questionnaire, but of course it is difficult, and the way questionnaires in WHO work are that there always has to be a nominated focal point. But from the pilot exercises we did, we realized that in many cases there were groups of people, groups of government representatives who worked together to give responses to this questionnaire. And your question about consistency is a very good one and very important one. What we did is, or we are in the process of doing, is we will share the responses given to the questionnaire with the nominated focal points. So we'll share the analysis that we have done of their responses, which will be released in a couple of weeks. We'll share it back with the focal points, and at the same time we also share the information that was received by us with the WHO country office, with the request that they follow up on this activity. And so when we will share again the questionnaire next year, we hope that country offices, WHO country offices, can really work with the ministries and the nominated focal point to ensure there is consistency in the responses that are given. So yeah, thank you for that question. Roger, I don't know if you wanted to add anything.
Maybe I take the other questions, and then I'm happy to comment. On at the end, maybe.
Great, thank you to both of you. I think you've kind of partly answered these two questions, but we have a question from Ernesto GIZ asking what plans are there to institutionalize the use of the heat map further at country and donor level. And again, you've perhaps touched on this a little bit. I don't know if you want to expand. And then again, a similar question that was touched on a little bit from the teacher. Have the results been discussed with individual countries and the interpretation of the results obtained? Perhaps you've just talked about that as well. But I don't know if you had anything else to add on those 2 points.
Maybe just one thing is that we are really keen on not only collecting this data annually, but actually trying to ensure that this data is actionable and that development partners can improve the way they work together based on the corrective measures suggested by the governments. And so we are currently discussing among SDG3 GAP agencies on how best we do that. We have shared the results or the responses we received with the country teams, with the WHO country teams, with the UN country teams. And our hope is that these responses we get from the government are really used by country teams to ensure that there's a work plan developed around how best they can implement the corrective measures suggested by the government. This is something that is still an ongoing process, so we're still trying to figure out the best way to ensure that the data is actionable and is actually used. But we think it has a high relevance, as Roger said before. You know, it's important that countries are given the opportunity to actually also assess how development partners are working and how well they're aligned. And this creates strong incentives also for development partners to improve the ways of working. So it's an important piece of information that we hope will be very relevant at country, but also at global level. Roger, maybe you want to add.
Yeah, I mean, just to say, I mean, on the point of involving other ministry staff and other ministries, I mean, this was discussed in an early draft of the questionnaire. There was a section which was to describe the consultative process, and in the end that was taken out because there was a lot of concern about the burden that this puts on respondents. So there was a desire to keep it as simple as possible, and it really was a very simple questionnaire. So I think it's something we have to sort of bear in mind. For my view, I think the triangulation from other respondents is probably a more of a priority, but we'll see. In terms of the point somebody made about consistency, I think, as I mentioned right at the beginning, this is always something we have to bear in mind, that there could be inter-observer variation. I mean, even if I'm the same person responding, how I respond next year compared to how I respond this year is not only dependent on the external circumstances. It may be how I'm feeling or how much time I've got, you know, so we do have to be careful not to over, you know, I think this is an indication, but it's not, you know, there are quite a lot of limitations. The plan to institutionalize is intended to do this annually. And the point about approaching individual CSOs directly, I think is well made. I think I made the point that I think overly focusing on trying to get one consolidated response is probably not helpful. As Isadora mentioned, there has been quite a lot of talk about using particularly the suggestions from government for improvement as a sort of quality improvement plan. Yeah, and I think there's some resistance to that from some agencies. I think, you know, that it's like, yeah, but I think it's definitely would be good to, if there was a follow-up, to ask the agencies how they've responded to the you know, what have they, you know, like a management response, if you like. So yeah.
Thank you to the both of you. We have a few minutes left before the end of our session, and I think it might be fitting to end with one more question from Nicola Wardrop, UKF CDO. And Nicola wants to know, to what extent do you think the answer to the question relating to the use of local monitoring systems might reflect broader alignment on health information management systems? So in other words, when we talk about the HDC, would the HDC membership find this the most informative relating to alignment on health information, or do you think this would be better covered by a full set of questions? Over to you. I see you nodding your head, or just perhaps you have an answer for us.
Maybe Roger, you can.
Yeah, so I think we don't really know. I mean, it was a fairly general question. I mean, I think it is striking that was an area that scored relatively lowly, and I think we know that there is this tension between, you know, where systems are weak, can agencies rely on those systems, or do they put in their own systems, and which is a short-term but, you know, not unsustainable approach. So, but I don't think we asked specifically about health information systems. I think my guess would be that, given that we were talking to the health ministry and we were talking about monitoring and evaluation, I would think it probably was included, but you know, we didn't ask specifically. I don't know if that answers the question correctly, but the wording was as it was about monitoring and evaluation in general rather than about specifically health management information systems.
Great, thank you so much, Roger. I think we've come to the end of this. Thank you. This has been a wonderful presentation. Certainly a topic, again, which has been broadly discussed, not just within the HDC, I'm sure broadly within the global health community. So very, very grateful for the work that has been done and for you both today for sharing your insights. As we close, perhaps, Isadora, you wanted to give us a couple of words before we part ways. Again, this session has been recorded. It will be made available online through the HDC YouTube channel, and we'll disseminate the slides through the HDC website. So thank you for joining. Thank you for the presentation. And Isadora, perhaps I'll give you the final words before you close. Thanks.
Thank you very much, Wenya, and thanks to all who have joined today and participated. We were very happy to share these insights with the HDC, and we plan on working very closely together with you. As Roger said, this questionnaire might also, we might include some more specific questions if there's a request or there's really an interest, and we can discuss with the HDC whether it would be interesting to include a more specific question on health system strengthening in the questionnaire for the next iterations. But most importantly, I think it really is important to reflect on how this data can be used by us, who are the recipients really of these messages that the governments share with us. I'm happy to share the slides with you, and also an updated analysis of the 52 responses we received this year will be released on the SDG3 GAP website in a couple of weeks. And maybe Wenya, you could then also share that information once it's released with the group. Thank you very much for joining again. Thanks. Bye-bye.
Thank you. Bye-bye.